Good morning, sir. My name is Neña R, Batan, a student nurse from City University of Pasay College of Nursing and School of Midwifery. And today, I'm going to perform the written demonstration in skills number 5, which is the hot Sitz bath. So, for the first step or for the prerequisite skills, first, you have to understand that the Sitz bath is a type of therapeutic warm, cool, or cold bath that can be used in the treatment of anorectal and gynecological conditions such as hemorrhoids, recent rectal surgery, tearing on the perineal area during the childbirth, episiotomy, and perineal, anorectal, and vaginal infection. And the next is, you also need to have knowledge about the use of Sitz bath to heal injured tissue, relieve localized pain, and prevent or treat infection. And then next is, you also have to be aware that it is the physician's responsibility to maintain patient safety by providing the correct temperature of the water and by providing physical assistance to the patient when lowering and raising them from the Sitz bath. And you also need to understand that the facility protocol regarding the Sitz bath. And the next is the preparation. So first, you have to review the specific protocol of the facility for performing Sitz bath if there are any. And then next is review or check the doctor's order whether you are going to provide a warm or chilled Sitz bath or if there are any medication that you are going to add to the water. So after checking the doctor's order, you can now review the instructions of all the equipments you are going to use and then make sure that they are in a good condition. So I'm going to check the condition of the equipment and materials. So they are all in the good condition. So next is verify the completion of facility informed consent documents. So I'm now going to verify it. And the next is review the patient's medical records to assess for increased risk for injury if you are going to use a warm Sitz bath due to sensory impairment or due to the history of a medical conditions like diabetes mellitus associated with impaired sensation. And also, you have to check if the patient has any allergies in the materials that you are going to use, such as latex or medication allergies. And then if the patient have any allergies, then you have to use an alternative materials that is appropriate. So I'm now going to check the patient's medical records. And then after checking the patient's record, you can now gather all the necessary supplies and equipment needed for the procedure. So I have here non-sterile gloves. I also have here a portable Sitz bath kit, which includes a basin, a bag, and a tubing. So you need to have this if you are not going to use a bathtub. But if you are going to use a bathtub, you have to prepare a rubber and a towel for the floor of the bathtub. And then I also have here a towel, a patient's hospital's gown, and then a bath blanket. And then I also have here a medication prescribed by the physician, a utility thermometer, and then a facility approved disinfectant, and then a pain assessment tool. And then next is the procedure. So first, you have to perform hand hygiene and then wear gloves to prevent the cross-contamination between the healthcare worker and the patient. So I'm now going to wash my hands. And then I will now wear gloves. And then next is identify the patient according to the facility protocol. So, ma'am, maaari ko po bang malaman ang pangalan po ninyo? Titignan ko lang po yung wristband nyo. Okay. And then next is establish privacy of the patient. So, as you can see, there are no other people here. It's just me and my patient. And then all the curtains, windows, and doors are all closed. And then next is introduce yourself to the patient and the family members. So magandang araw po, mama ko po si Neña R, Batan, ang attending nurse po ninyo para po sa araw po na ito. So So, kamusta po kayo? Ano po yung nararamdaman po ninyo? So, kinakabahan po ba kayo sa gagawin po nating procedure ngayon? Hindi po. Okay, that's good. And then next is explain the procedure to the patient. So, ma'am, ang gagawin po nating procedure ngayon ay hot Sitz bath. So, isa po itong therapy na marami pong magagandang naidudulot sa katawan po natin. Katulad na lang po ng pagpapabilis po ng paggaling at paghilom ng sugat po ninyo at ng tahi dulot po ng panganganak po ninyo. So, sisiguraduhin ko pong magiging mabilis lamang po ang procedure na ito, kaya wag po kayong mag-alala. Titiyakin ko rin pong hindi po kayo makakaramdam ng anumang pong sakit sa procedure po natin na ito. And then next is assess the patient's general health status including their pain level using a facility-approved pain assessment tool. So, ma'am, kamusta po ang pakiramdam po ninyo? Meron po bang masakit po sa inyo or may nararamdaman po ba kayong kakaiba? Masakit lang po yung sugat po ninyo. So, in a scale of 1 to 10 po, so, maaari niyo po bang ilarawan or sabihin sa akin kung gaano po katindi ang sakit na nararamdaman nyo? 1 po para sa pinakamababa at 10 naman po sa pinakamasakit. 7. Okay po, thank you. Then, after assessing the patient, then next is you have to encourage the patient to void. So, ma'am, bago po natin simulan yung procedure na ito, pwede pong gumamit po muna kayo ng CR or comfort room para po umihi po kayo. Para po tuloy-tuloy po ang procedure natin. Thank you. And then next is prepare the Sitz bath and add medications to the water if prescribed. And then if you are going to use a bathtub, place a rubber ring covered with the towel on the floor of the tub for patient's comfort. And then fill the tub with enough water to cover the patient's buttocks and genital area. And then next is check the water temperature with a thermometer. The temperature of the water should be 34 to 37 degrees Celsius for warm Sitz bath. It is used for wound cleaning, healing, and relaxation. Sitz bath can also be provided with cool or chilled water. For pediatric, older, and with fragile skin patients, they should be treated with warm or cool water temperature. And then next is, if you are going to use a Sitz bath kit, clamp the tubing and fill the bag with water with a same temperature and then hook the bag on a hole or on the IV pole above the patient's head. So, I am now going to hook the bag on the patient's hole. And then next is assist the patient in a comfortable position and then cover them with a towel or a bath blanket. So, ma'am. And then I'm going to cover her with a bath blanket. And then encourage the patient to sit in a Sitz bath for a prescribed period of time. And then warm Sitz bath are usually longer than cold or cool Sitz bath. So, ma'am, as per doctor's order, kailangan po natin magstay sa Sitz bath for about 15 to 20 minutes. So, mag-relax lang po kayo at babalikan ko po kayo mamaya. And then after that, check the patient after 5 to 10 minutes to confirm if the patient is in a comfortable position and if the water has remained within the correct temperature range. If you're going to use a Sitz bath kit, unclamp the tubing and then allow the water to refill the basin. So, ma'am, okay lang po ba kayo? Nasa komportable po ba kayong posisyon? Di po ba kayo nahihirapan? Then, I will now unclamp to allow the water to refill the basin. And then, if you are using a bathtub, check the water temperature and then refill the tub as needed. And then, after the prescribed length of time, assist the patient in getting out of the bathtub or to stand. And then raise the patient slowly and then assess for dizziness and poor balance and then use a towel to dry the patient. So, ma'am, tapos na po yung oras po natin para po sa Sitz bath. So, kailangan na po natin umalis. umalis. So, tutulungan ko po kayong tumayo, okay? So, dahan-dahan lang po. So, may nararamdaman po ba kayong kakaiba? Nahihilo po ba kayo? Or hindi po ba maganda yung pakiramdam ninyo? Okay, that's good po. And then, next is assess the skin integrity and the condition of the treated area to evaluate whether the Sitz bath had the desired therapeutic effect. So, I'm going to check the patient's perineal area. So, there are no blanching, blistering, and burning and swelling or redness on the perineal area. And then, next is assist the patient in getting dressed and place them in a comfortable position. So, I'm going to dry the patient first. And then, assist her in a comfortable position. Okay, so ma'am, komportable na po ba kayo sa position ninyo? Thank you. And then, after assisting the patient in getting dressed and placing them in a comfortable position, you can now clean and return all the materials that have been used and then dispose the waste materials according to the facility protocol. So, I'm now going to return all the materials that have been used. And then, I'm going to put off the gloves. And then next is for the post-procedural responsibility. So first you have to assess the patient's tolerance of the procedure and for any unexpected outcomes including signs of thermal injury. So as I have said earlier, there are no thermal injury noted. There are no blistering, burning, blanching, redness, and swelling on the patient's perineal area. And then next is apply or assist the patient in the application of prescribed topical ointment in the affected area. So if it is only needed. So I'm going to help you apply an ointment. Okay. Then next is educate the patient or the family about how to perform the procedure and how to contact the healthcare provider if there are problems arise and if there are clinical signs and symptoms present that can indicate for medical problems during or after the procedure, and that should be reported immediately to the healthcare workers. So, ma'am, ito pong procedure na ito na hot Sitz bath, pwede niyo po siya magawa sa bahay po ninyo kapag nakauwi na po kayo. So, ang kailangan niyo lang pong gawin is sundin po yung mga procedure po na ginawa po natin kanina. So, kailangan niyo po ng basin with hot water and make sure po na yung temperature po ng water ay hindi po mag-exceed sa 34 to 37 degrees Celsius para po maiwasan po natin yung injury. So, makakatulong po ito para po mas mapabilis po yung paggaling po ng sugat po ninyo. And then, kapag meron pong nagkaroon po ng problema, kailangan nyo pong sabihin po agad ito at kumonsulta po agad kayo sa physician ninyo or sa mga healthcare workers at tumawag po agad kayo ng tulong. And then next is document and record all the necessary information such as the date and time of the Sitz bath, the temperature of the water, and then indicate if there are any medications used, and then the patient assessment including the skin assessment before and after the procedure, patient's level of pain, the patient's response, and patient's tolerance to the procedure. And after documenting it all, you also have to note any unexpected patient events or outcomes, interventions performed, and whether the treating clinician was informed or notified or not. And then also a note for the family education, including the topics presented, their response to the topics provided, their plan for follow-up education, and then the details regarding any barriers to communication or techniques that promoted successful communication. So that's all.